Hi, the question of the day is finasteride required and mandatory after hair transplantation? The short answer is no. The hair will continue to grow whether or not you're on finasteride. The question really should be is, should you be on finasteride after hair transplantation? In reality, the majority of my patients after surgery do go on some sort of preventative medication, and the fact of the matter is that they are on it because they want to preserve the surrounding native hair in addition to their transplantation. And there's really good reason for this. First of all, as we know, hair loss is a progressive situation. Hair continues to thin. The younger you are, the longer time you have to lose hair. So it's an excellent idea to get on something to prevent further loss. I always give this analogy to my patients. Hair loss is like a bucket of water. A bucket with a hole in it. Now, the bucket will continue to lose water as long as it has that little hole in the bottom. And we can always top the bucket off with water, but there's always going to be a slight leak in the bottom because of that hole. Hair loss is a similar situation. There's always going to be hair that's going to be lost during your lifetime. Now, hair transplantation will improve and restore areas that have been lost, but as you know, the donor area is not unlimited. So, medication is in some way stopping up the bottom of that bucket. Now, it's not always perfect, but it can slow it down to a point where the results can last for many, many years, and hopefully you may not need to come in as often as you would had you not been on medication. And that leads into another great reason for being on medication. It helps to preserve the look that you want for a longer period of time. Now, although most surgeons, myself included, would not recommend being more aggressive during hair transplantation because you're on medications. I wouldn't lower your hairline much lower or do work in the crown if you're a young patient. But on the other hand, if you are on medications and for many years you've been able to stabilize your hair loss, you can later on be a little bit more aggressive, say in your hairline or in the crown, other areas. So over time you may be able to get more of those goals that you had in mind had you not been on medication. So it is an excellent idea. I recommend my younger patients to get on as many different treatments as possible. As we're talking now, finasteride, it's one of the most effective medications out there. I encourage you to consider it, at least for the sake of maintaining hair loss in the long run. So is it necessary to take it for transplant? No. Is it a good idea? I think it is for most patients. So I would encourage you to talk to your hair transplant physician to determine if it's right for you. Thank you very much.